Helen Goodman.
Thank you very much, Mr Deputy Speaker. I'd like to begin by congratulating my honourable friend, right honourable friend from Oldham West, for securing this very, very important debate. Over 5,000 of my constituents are on IB or ESA, and they are facing this terrible system. I'd like to give a couple of examples. Mr H, a man with a double leg amputee, told to undertake an 80-mile round trip for his work capability assessment. Mr W, serious mental health problems. He had a panic attack and was physically sick during the WCA, but he was told he was fit for work. His wife believes he's being victimised by Atos. Mrs D, a district nurse who broke her back at work, told she was fit for work. Mrs M, treated for cancer in July 2010, deemed fit for work before the results of the operation came through. Her appeal won't take place until next month. Mr E. Other people the RNIB are worried about, completely blind for 16 years, forced to give up work, but told by Atos fit for work. We need fundamental reform of the system, as the Shadow Secretary of State has said, including the descriptors. And I want to say something about the descriptors because I think there are problems with the descriptors for mental health, but also on physical health in every category. I'm going to read the conditions which have a score of 9. This is a score which means these people are all deemed capable of going to work. A person who cannot mount or descend 2 steps unaided by another person, even with the support of a handrail. A person who cannot, for the majority of the time, remain at a workstation, either standing unassisted by another person or sitting for more than 30 minutes before needing to move away in order to avoid significant discomfort or exhaustion, deemed fit for work. A person who cannot pick up and move a 1-litre carton full of liquid, fit for work. A person who cannot use a pencil or pen to make a meaningful mark, deemed fit for work. A person who cannot use a suitable keyboard or mouse, apparently fit for work. A person unable to navigate around unfamiliar surroundings without being accompanied by another person due to sensory impairment, fit for work. A person at risk of loss of control leading to extensive evacuation of the bowel and or voiding of the bladder, sufficient to require cleaning and a change in clothing if not able to reach a toilet quickly, fit for work, and only scoring 6. A person who at least once a month has an involuntary episode of lost or altered consciousness resulting in significantly disrupted awareness or concentration. Also, fit for work, only 6 points. As RNIB point out, it's possible to have an epileptic fit once a fortnight and be deemed fit for work. Well, as it happens, Mr Deputy Speaker, my husband suffers from epilepsy, and the last time he had an epileptic fit, he had the headache and the hangover for several days. So the notion that anybody can do a work if they're having this once a fortnight is completely absurd. A person who cannot learn anything beyond a simple task such as setting an alarm clock, fit for work. A person who has reduced awareness of everyday hazards, who leads to a significant risk of injury to themselves or others, or damage to property or possessions such that they frequently require supervision, fit for work. Not even safe for their colleagues, but somehow deemed fit for work. A person who cannot cope with a minor planned change, such as change to lunchtime. A person who is unable to get to a specified place with which they are familiar without being accompanied by another person. A person engaged in social contact with someone unfamiliar to the claimant is always precluded due to difficulty relating to others or significant distress experienced by the individual. All these people are deemed fit to work. This is a cynical exercise, and ministers know it's a cynical exercise. In the current situation, none of these people are ever going to find work. This is a cruel and demeaning system, and it should be changed now.
Right.
Deputy Speaker, and it's an honour to follow my fellow North Eastern MPs, my honourable friends for Bishop Auckland and North Durham. Like my honourable friend for Bishop Auckland, I want to use my contribution to demonstrate to the House, with a series of caseloads that I have, the crass, degrading and unprofessional way in which my constituents are being treated. A constituent of mine, let's call her Mrs J, is 51 years old and suffers from diverticular disease. This leads to a compacting of her bowels, which means that Mrs J soils herself on a daily basis, requiring a change of clothes. Often she requires hospital treatment because when her bowels get heavily compacted, she's unable to deal with the matter without medical intervention. She was on contribution-based ESA. She was only allowed to be on that for 365 days, and that expired in April 2012. She asked to be reassessed on the basis of her condition. Her assessment stated that she was fit for work. She appealed this decision. It was declined. She had to go down the tribunal route, but as she said to me in her email in September last year, and I quote, Mr Deputy Speaker, "So now I'm faced having to go to a tribunal which I was told today will take months. I've got no representation. I'm unable to go to the CAB, as when I attempted to do this, I sold myself en route, so ended up going home in tears. What can I do? I've got not a penny to my name. I've borrowed just to survive since April. I'm now faced with another 3 to 4 months with the tribunal decision again without money. I don't know what to do and cannot carry on like this. Surely this isn't how you expect people who legitimately cannot work. And the likelihood is I've failed my appeal just because I've not worded my appeal correctly when clearly my medical records and specialists have stated otherwise. Please, please help before I end up on the streets." A gentleman in my constituency, let's call him Mr D, served in the forces for many years. He's now in his late 50s. In the last 18 months, Mr D has undergone extensive surgery to the brain following a tumour. And in November 2011, he was informed that he required further surgery, this time to his neck, to remove the growing tumour. At the same time, at precisely the same month, Mr Deputy Speaker, Atos assessed Mr D as being fit for work. That assessment was undertaken by someone who was not trained as a doctor during the period in which Mr D went to these assessments with a gaping wound in his head and still undergoing treatment. Mr Deputy Speaker, doesn't it make an entire mockery of the whole process if this is allowed to happen? Doesn't it cast real doubt as to the effectiveness and accuracy of the whole system? But most ominously, doesn't it reveal what the true intention of this system is? Several of my constituents, far too many to be isolated incidents, have told me that they were asked during the assessment by the person carrying it out whether they just sat around all day watching Jeremy Kyle. Now, I do expect uninformed, unprofessional and crass comments from the likes of the Chancellor of the Exchequer, Mr Deputy Speaker, but not from medical professionals with a serious task of determining whether a person is fit for work, presumably having to undertake that in an objective and non-prejudicial manner. I want to mention another woman in my constituency. Let's call her Mrs M. She left school at 16 and she worked diligently for 33 years. She paid her taxes. She was made redundant a couple of years ago at just the time when she was starting to suffer from ill health. Mrs M suffers from Crohn's disease, which has led to severe diarrhoea, incontinence and abdominal pain. She's had surgery to remove a large section of her bowel, but the symptoms are getting worse. And as you may know, Mr Deputy Speaker, there's no cure for Crohn's disease. She will not recover. There'll be a gradual and irreversible increase in the severity and the frequency of her symptoms. Now, Mrs M is a proud and dignified woman. She's embarrassed about her condition. She wants to do nothing more than work, but she's unable to do so. She suffers from about 2 bouts of diarrhoea a day, of which she has no more than a second's notice. She cannot leave the house unaccompanied. She was assessed as having 15 points with limited capability for work. Her assessment and appeal were degrading, insensitive and unprofessional. She was described throughout in her appeal notes as a man. Incorrect dates, fictitious telephone calls were placed on her files. In other words, Mr Deputy Speaker, lies. Mr Deputy Speaker, Mrs M was told that she could wear a nappy for work. What sort of country have we become? What sort of ethical values does the government have if that's the degrading and crass way in which decent, law-abiding constituents of mine are being dealt with? Now, I believe that everybody who could work should be entitled to work, and the role of the state is to help that being achieved. But all the evidence that I have in my constituency demonstrates that the system is not working, and the most vulnerable and ill constituents in Hartlepool are paying the price. The government is treating my constituents like dirt. It needs to change.
Deputy Speaker, last week I held a meeting in my constituency for a number of disabled constituents, their carers and family members and the organisations that support them, and I just want to highlight 2 or 3 messages to the Minister which build on some of the things that have been said this afternoon. Firstly and most importantly, I think the Minister needs to understand how totally discredited now this whole system has become. My constituents told me absolutely categorically last week that they believed the whole system was deliberately designed and operated to trick them, to bring them to incriminate themselves, to catch them out. They firmly believe that the system is deliberately designed not to assess and then to help them into work if they're fit for work, but simply to stop paying benefits wherever possible. And I regret that they continue to believe, and I know this is not the case, but they continue to believe that Atos are paid to bring that about. Now, whether or not the system is deliberately designed to trick them, it seems pretty clear to me that there are far too many instances where trickery, misleading people, distorting what they have done and said and reported and drawing conclusions from that is happening far too often, and it is absolutely a disgrace that we should run a public assessment process in such a discredited way. Either the Minister has to sort the system out, I won't because others wish to join in, either the Minister has to sort the process out or address this fundamental scepticism and mistrust in the system. Many of us this afternoon have said we don't believe that's possible unless the system is scrapped and we start all over again. I say to the Minister, because I think he's going to say this in response to contributions, I understand this is an occupational assessment, not a medical assessment. I understand why it's not just doctors but other forms of occupational health professionals who can carry out the test. But I think it is disgraceful when those occupational health professionals have no understanding of the underlying medical condition and can arrive at such distorted judgments in relation to a person's fitness for work. I also want to report to the Minister that of the constituents who I met last week, around a couple of dozen, about half of them had no idea that they could take a companion to the assessment process. They said they hadn't been told, and those who did know that they could take a companion, and sometimes had done so, were told that that companion was not made to feel welcome, was not enabled to assist them, and I'm sure the Minister will appreciate, particularly, for example, where you've got someone who perhaps suffers from autism and will behave in a particular way in response to these sorts of questions, trying to please, trying to give the answer that they think is wanted rather than the answer that is accurate, that having a companion who can support and, if necessary, intervene is very important indeed. This bit of the system is not working and the Minister needs to look at it very carefully. When the work capability assessment was introduced, we knew that it was going to be difficult. We knew that we were trying something new, and we built in the review process that led to the appointment of Professor Malcolm Harrington and some of the early improvements which I think we all welcomed. But I think what I feel today, Mr Deputy Speaker, is that we have to face up to the fact that actually it is no longer possible to make the kind of improvements that make this system viable at all. I get the impression, perhaps the Minister will correct this impression this afternoon, but I get the impression that the government have now gone from moving to try to improve the system to either defending it or frankly washing their hands of it. And I honestly do not believe that is a good enough response. If the Minister is going to say that there isn't a problem, improvements can continue, and that these are simply still early days teething troubles, I simply want to say to him that when you get the extent of reports all around the House, all around the country, of repeated systemic problems, it is time to look again. The Minister, I am sure, will remember, as many in this House do, as I most certainly do, the last time we had such a failure, whatever the intentions, such a failure of public policy implementation, the Child Support Agency. It took us 20 years to realise that the design that had been put in place simply could not work. Please let us not wait 20 years to realise that this system cannot work and must be started